You're watching ABC4 News, celebrating 75 years.
Welcome back. In Utah, nearly 1 in 3 women will experience domestic violence in their lifetime. And this is a terrifying statistic and higher than the national average. So as a part of Domestic Violence Month, we are speaking with Leah Moses, who is a certified midwife with Intermountain Health. Leah, thank you so much for joining us today.
Thanks for having me.
So tell me a little bit on what you guys are doing to address domestic violence.
Right, so within Intermountain, we have started a program where in clinics and also on labor and delivery as well, we ask women, are you safe at home? There are a couple of specific questions, but the idea is when you come into a women's healthcare visit, it's a safe and confidential place, or should be, where you can find resources and learn more about safe and healthy relationships, because we know that relationships affect our health. So our medical assistants sometimes ask the questions, sometimes as providers we ask the questions. We want to make sure that women understand and know that if they are experiencing this in their life, that we want to help.
It is such a simple question that I'm sure can bring up a lot of topics in that. What do you see from patients when you do talk about that? I mean, what comes from it?
Well, what we ask is, are you now in your relationship, physically abused? And we have some specifics: hit, kick, slapped. I mean, these are challenging things. And then also we talk about emotional abuse as well. Are you in a relationship of coercive control? And then the other thing too that's really delicate is to ask about sexual abuse. And then the question that I really love, actually, that promotes quite a bit of conversation with my patients that come in is, has this ever happened to you in your lifetime? And I think that that's really critical, because it may not be happening in the moment, but we know that because our health is affected by our experiences, it may be something that happened long ago that women need to come to terms with and find some resources for help.
And I'm sure a lot of women too may not even realize what they were in at that time as well, so it gives them time to reflect and heal from that process.
Right, and when we ask these questions, we ask them of everyone. So every new patient that comes into our clinic, and when I say our clinic, I am at the Layton Hospital with Intermountain, but this is happening across the Intermountain system, and it's something that's really important to us because we want to cast the net wide and really capture as many as we possibly can, because the stats are so high, especially here in Utah.
You've been in the healthcare industry for a while. Is this something that we see across the board with people knowing to ask these questions, or is this kind of a new concept for people?
Well, screening in healthcare is not new, right? We have, colon cancer screenings, and we have mammographies and all of those things. Well, just like even taking a blood pressure or a temperature in a clinic, asking, are you safe at home, can be really critical for people who come in who are experiencing this and who do need help.
What are some of the signs that often get overlooked with domestic violence?
Sometimes we think that it's the black eye, broken arm, and that may be the case in emergency rooms, and that might be something that we typically see in the media, but honestly it's gastrointestinal issues, pelvic pain, chronic headaches. The effects of toxic stress can really affect all of our health, all of our systems. So we don't necessarily expect women to come into the clinic and be able to identify those as effects of abuse, but we want to be able to do that on our end and really watch for the signs and symptoms and help identify those and get people the help that they need.
I had never heard of those signs. I'm so glad that you shared that with us. If someone has a friend who they say, oh, that seems like my friend and what they're experiencing, do you have any advice on how they can talk to them and show them that they do support them?
I do. There are so many resources. One is the National Domestic Violence Hotline has a power and control wheel. You can find it online. It's really easy to look up. One thing that we do advise also is to call the link line. The Utah Domestic Violence Coalition is really robust in its services across the state. The member programs want to help, and the link line is a free hotline that you can call as a concerned friend, family member, or even as a clinician, and get people the help that they need.
It's such an important topic. Leah Moses, thank you so much for joining us and talking about this. Before we go, Leah just mentioned it, but we also want to show you it one more time because this hotline is so important. So please take a look at your screen right now. We're going to be showing you the domestic violence hotline number. That hotline can connect you to a variety of resources. You can see it right there, 1-800-897-LINK. This can include providing resources like shelter, legal help, or maybe just someone to talk to. It's free, it's confidential, and available 24/7. So please take a picture, write the number down, or call right now if you or someone you know needs help. Stay with us. We'll be right back.